Cancer is a growing national and global challenge. It continues to exert a profound toll on the lives of Kenyans and health systems. The burden of cancer is not just medical, it is economic, social, emotional, and psychological. For this reason, we must approach cancer not as a health issue alone, but as a national development priority that requires a multi-sectoral and multi-stakeholder approach. If we are to meaningfully address cancer, then all sectors, not just the health sector, must come on board. We must embrace a multi-sectoral national response to cancer. We must break down silos. The Ministry of Education must ensure that cancer awareness is integrated into our school curricula and life skills programs. The Ministry of Agriculture and Livestock Development, as well as the Ministry of Investments, Trade and Industry, must regulate carcinogenicity. Wow, this one is a big one. Today we stand united, not just in sorrow, but in our resolve to turn the tide against cancer. We are not powerless. We are powerful when we join hands, when we unite our voices, and when we act with purpose. Every Kenyan has a role in this battle. Whether you shape policies, heal patients, educate minds, grow food, or inspire the next generation, your actions matter. Your voice matters. Let us leave this summit not with words alone, but with a commitment to bold, measurable steps towards a cancer-free Kenya. Let us honor those who have lost by ensuring their pain is not the legacy of our future. May we draw strength from our unity, courage from our convictions, and hope from our shared humanity. Together, we can and we will defeat cancer.
I'm pleased to inform you, Your Excellency, that we are working closely to have digital screening tools, and as you've seen outside, the use of the AI so that we can be able to interpret the data from the radiology and the rest. But the elephant in the room is on capacity building. We have to continue training our people, and I'm pleased to let you know, Your Excellency, that my work at the IEA still continues while I'm here to help the country. We are looking at Kenyatta University Teaching Referral Hospital Cabinet Secretary, and I have made recommendations that it becomes the centers of excellence so that we can be able to train Kenyans and Africans. And also looking at the strategic collaboration, public-private partnership is very critical. One thing that, Excellency, I would like to mention here, according to standards, we're supposed to have 1 machine per million population. Kenya at the moment is standing at about 19 machines. So we have a deficit of about 36 machines. If you do a rough estimate, that will cost us about 90 billion Kenya shillings just to procure the linear accelerator.
Today we stand united, not just in sorrow, but in our resolve to turn the tide against cancer. We are not powerless. We are powerful when we join hands, when we unite our voices, and when we act with purpose. Every Kenyan has a role in this battle. Whether you shape policies, heal patients, educate minds, grow food, or inspire the next generation, your actions matter. Your voice matters. Let us leave this summit not with words alone, but with a commitment to bold, measurable steps towards a cancer-free Kenya. Let us honor those who have lost by ensuring their pain is not the legacy of our future. May we draw strength from our unity, courage from our convictions, and hope from our shared humanity. Together, we can and we will defeat cancer. Cancer is a growing national and global challenge. It continues to exert a profound toll on the lives of Kenyans and health systems. The burden of cancer is not just medical, it is economic, social, emotional, and psychological. For this reason, we must approach cancer not as a health issue alone, but as a national development priority that requires a multi-sectoral and multi-stakeholder approach. If we are to meaningfully address cancer, then all sectors, not just the health sector, must come on board. We must embrace a multi-sectoral national response to cancer. We must break down silos. The Ministry of Education must ensure that cancer awareness is integrated into our school curricula and life skills programs. The Ministry of Agriculture and Livestock Development, as well as the Ministry of Investments, Trade and Industry, must regulate carcinogenicity. Wow, this is a big one.
Let me say that to ensure that policy translates into impact, counties must operationalize the national strategies pillars, from prevention and screening to diagnostics, treatment and palliative care at every level of the health system. 2, stakeholder coordination must be institutionalized. National government, ministries, county departments, healthcare workers, NGOs, community health volunteers, and development partners must align on plans, funding, and messages. 3, community engagement and demand creation, as we have done in Kisumu, must be at the center, because the greatest interventions fail if people do not trust or understand them. 4, we must invest in surveillance, training, research infrastructure, including national reference laboratory and robust data systems. 5, and lastly, and critically, we must scale up financing mechanisms, including public-private partnerships, domestic resource mobilization, and risk pooling through insurance to cushion Kenyans from catastrophic health expenditure.
Through the National Equipment Service Project, we are strengthening our cancer care by equipping our national and county referral hospitals with essential screening and treatment equipment. Mammograms have already been installed in Kisumu and Kerugoya, while CT scans are operational in 15 county referral hospitals, with installation underway in another 15 additional counties.
put our hands together as well to welcome Dr. Meli, the acting CEO.
Council of Governors, represented by our able Governor Anyang, that you honored to participate in this meeting. And all the stakeholders under the leadership of our cabinet in the entire cancer ecosystem within the country and without working towards one vision to have a very busy schedule. Allow me
the world where cancer is prevented or cured and every survivor is healthy. I think vision and vision. Our 5-year goals are that over 5 years we're going to advance to. And this shows the makeup at present of our regional council. Spend the rest of this talk talking about ask of global efforts to improve cancer care, clinical research, and leadership development. Let's start with quality.
Introduction of the partnership that we've had with the American Society.
And finally, after keeping him waiting for...
Okay, one more. All right. Thank you very much.
And there we have it, the launch of the radiotherapy protocol. Piga makofi kwa nguvu kidogo.
If you look at the burden of cancer in this country, the CEO, Dr. Meli, has talked about the numbers. We know the numbers. I don't have to recite those. It is significant. And this is not only in Kenya, it's across the continent of Africa. The one thing we must ask ourselves is it affordable to actually provide good, equitable, accessible care to that burden? The Kenya government is doing a whole lot. And we must thank the government for the efforts that have been mentioned here by those who have had, this burden, have suffered this burden. But when you look at the fiscal space, the available money, and you look at our structure of health financing, we would need about $1 billion, Cabinet Secretary, in my view, and PCS, to actually take care of everyone who needs to be taken care of, the screening, the prevention, and the care and treatment needed at our current burden. I would estimate that at about $1 billion. That's about more than 100 billion shillings, which is close to a quarter of our health expenditure generally, which is unaffordable in a country whose GDP and population and the tax collection is as it is right now. We have to face the reality that the fiscal space is low. And also knowing that the donors, and I talked about this in the first summit, the donors do not support the non-communicable disease sector, largely because most of the donor aid that we know that's now declining is actually driven by what we call global health security. It is the disease you have, let me keep it away from my people. That's really what drives the global health security. Of course, we have partners who've stuck with us, and that's the private sector in this area, and we thank them. But we know that the development assistance in the multilateral structure is guided by global health security. So the cancer care of hypertension and diabetes is a national agenda.
We are not merely responding to disease. We are building the infrastructure systems and workforce that can anchor medical tourism, regional referrals, and clinical trials within Kenya. Our ambition is clear: to serve not just Kenyans, but also our Eastern and Central African neighbors who seek accessible, affordable, and high-quality cancer care. This ambition cannot be achieved in isolation. The government of Kenya, through my office, has prioritized health diplomacy as a cornerstone of our external relations. Through bilateral and multilateral partnerships, we are engaging meaningfully with international organizations and cancer control bodies, including the World Health Organization, the International Atomic Energy Agency, and Professor here spoke to it, the Union for International Cancer Control, and numerous UN agencies, regional blocs, and philanthropic institutions. As a government, we recognize that cancer is a borderless crisis that requires borderless cooperation. That is why we have reaffirmed our role in international cancer diplomacy by participating in global cancer summits and World Health Assemblies, strengthening our voice in regional economic blocs to prioritize cancer under trade, health, and human capital development, hosting South-to-South collaborations for oncology, training, and knowledge exchange, and aligning our policies with UN and WHO global cancer targets, including the target to reduce premature mortality from non-communicable diseases by 1/3 by 2030. We are determined to position Kenya as a credible, responsible, and proactive partner in global cancer control. We shall collaborate with international organizations and other industry players in cancer care, in research, innovations, and in developing new health products and technologies. We are ready to learn, ready to lead, and ready to leverage on our networks to serve our people and the region better.
Data is our compass. Our National Cancer Surveillance Platform is enabling real-time data to drive smarter, targeted decision-making. On prevention, the ministry has successfully integrated the HPV vaccine into our routine immunization schedule, targeting adolescent girls aged between 9 and 14 years. This is a momentum step towards the elimination of cervical cancer. We are expanding our community-based screening for breast, cervical, prostate, among other cancers, through community health promoters and mobile outreach teams. Early detection saves lives. We are also strengthening our referral system to ensure timely follow-up and care. No Kenyan should suffer or die because of delayed treatment.
The Ministry of Education must ensure that cancer awareness is integrated into our school curricula and life skills programs. The Ministry of Agriculture and Livestock Development, as well as the Ministry of Investments, Trade and Industry, must regulate carcinogenic products which promote health and nutrition and ensure food safety. The Ministry of Environment and Forestry must address environmental risk factors such as pollution and hazardous exposure. The Ministry of Information and Communications and the Digital Economy must support cancer registries, telemedicine, and digital patient care platforms. The National Treasury and Planning must prioritize and sustainably fund cancer prevention and treatment programs. The Ministry of Roads and Transport must ensure improved networks to make it easier for Kenyans to reach screening, diagnostic, and cancer treatment centers, and the list goes on. And crucially, county governments under devolved healthcare must localize, fund, and lead community-level interventions. In short, we must embrace a whole-of-government and a whole-of-society approach. We must bring all hands on deck, including the healthcare workforce, pharmaceutical companies, civil society, the private sector, academic institutions, faith leaders, media houses, communities, and above all, cancer survivors and caregivers.